I think over the last 2 or 3 weeks, essentially every swab I've done, apart from one, has come back positive for influenza A. We're running off our feet. We're very busy. If one of us gets sick and we are working short-staffed, it just compounds the problem. So we're doing what we can to try and make room for everybody to be seen, but it's overwhelming. We don't have enough resources to see everybody, unfortunately. If you walk into any pharmacy and see the empty shelves where you're supposed to be able to find cold medicine, children's analgesics, Tylenol and Advil, we're seeing longer wait times in our urgent care clinic, where people are waiting 4 or 5 hours sometimes to see a physician, or being turned away towards the end of the even after supper, being turned away from our clinic. If we flattened the influenza curve, I think we would be in much better shape. We're not going to avoid influenza forever, and no one's suggesting that we do that. But if we did sort of spread out, and rather than all of us jump back into the flu pool at the same time and hope there's enough lifeguards around to help everybody, if we took turns and spread it out over the entire cold and flu season, I think it would be in better shape to kind of cope with all this. So I think there are things we can do. Nobody's suggesting that we go back to nobody traveling and limits and gatherings and things like that. But I think if we did a few smart things, we would be able to help out with things. I've proposed 3 things. Masking up when you're indoors with other people. I think it just makes sense when there's lots of this virus around. Staying home when you're sick. If you're feeling unwell in any way, then assume you're contagious and act accordingly. Just keeping up to date with your vaccines, your influenza shot, go and get your flu shot, go and get your COVID booster. The most important thing I can say to parents out there is get your kids vaccinated, go get your flu shot. We think of, most people think of their kids not being vulnerable to influenza, but that certainly is one age group that is very vulnerable to influenza. So get your kids their flu shot.